Hey, I'm Dr. Ruth Roberts, your pet's ally, and today I want to talk to you about body weight for your dog or cat. And I'm going to use some examples for the dog because this is where I get the most frequent questions. We're concerned about our pets being overweight, and because many of you actually have pets that you exercise with, that you've been controlling their diets very carefully for, you're actually more concerned about them losing too much weight and too much muscle. So I'm going to show you a couple of things that will help you know what's going on. And I'm going to show you sort of the conventional way to do it with the body condition scoring systems and the muscle condition scoring system. And then I'm going to show you the down and dirty, easy way to do it. So let's dig in. So first up is the body condition scoring system. And this is the World Small Animal Veterinary Association's global committee. It's a scale of 1 to 9. Some veterinarians use the Hills score, which is on a scale of 1 to 5, but this is what I got accustomed to. So we want to think about two things here. This is a scale of 1 to 9, but we have 5 pictures. So that means 4 to 5 is ideal. And I would say to you that 4.5 to 4 really is what's ideal. So we should be able to see a nice tuck in the waist from above. We should get the idea, especially for these last few ribs, that they are there. And from the side, we should see a little tuck up as well. And I'll explain to you more about what these bars mean in just a moment. And with your hands over the top of the ribs in this area especially, you should be able to take this much pressure, so pretty gentle pressure, and feel ribs underneath. So I want you to get used to really palpating or feeling your pet so that you know what things are like now, and then you can kind of compare things later. And I think this is especially important as our pets reach midlife. So say 5 years of age. So that's roughly 40, and that's when things can begin to go sideways if we're not managing our nutrition and our activity and supplementation correctly. For humans, same thing for dogs and cats. So there is the body condition score, and that's used, okay, is my pet thin? Is my pet fat? Are we good? More importantly, I think, is something called muscle condition scoring. And let me show you what that looks like. So this is pamphlet put out by, again, the World Small Animal Veterinary Association about muscle condition scoring. And so, here's the technical way to do it. You're going to look, you're going to feel the spine, the shoulder blades or scapula. So right here are the scapula, the skull. This dog actually looks pretty thin on muscle to me, sort of in all of these pictures. And then the wings of the ilia over the hips. So the epaxial muscles on the sides, so meaning kind of coming down the spine, or where you first tend to notice muscle loss. You can have a fat dog at a score of 9 with normal muscle mass, but you can also have a fat dog at a body scale or a body condition score of 9 with severe muscle loss. And that's why it's important to make these distinctions, because how we're going to treat those two animals is very, very different. The fat dog that's young with a ton of muscle, we're going to march his ass into thinness. The older dog that is obese with minimal muscle, we're going to be very, very cautious and make sure that we are doing things that will help build muscle, at the same time help him lose weight, so we don't get things going on like severe arthritis pain that's limiting his movement, and that may be why there's muscle mass. So there's two things. You're going to palpate all of this stuff. You want to feel the difference between the skin, the fat, the muscle, and then the underlying bone. So again, in the thin dog, normal weight dog, this fat layer is going to be about like this. In a dog that is obese, you may see a fat layer that's more like this. and then you've got skin over the top of it, and then you've got the muscle down here. And conversely, you can have a dog that's obese that has a fat layer like this with skin over the top of it and really not very much muscle. And this is the critical distinction to make. Now, here's the deal. That takes a little bit of getting used to. And I've had pet owners routinely say, I don't know, is my dog too thin or too fat? I can't tell. And so I'm going to give you the quick and down and dirty way to do this. And that is this. So I told you I was going to explain this picture with the funny bars on it a little bit more. So here's the 4 little bars that I showed you earlier. 1, 2, 3, 4. This is going to dial it down to a number for you to keep track of. So 1 is you're going to take a soft tape measure like a seamstress would use because it's nice and flexible, it won't hurt. I have seen people do this with stainless steel tape measures, not a great idea on a squiggling pet. You get the idea why. So the first is right in front of that rear leg, you're going to take the tape measure all the way around and write down how many inches or centimeters that is. The second measurement, same thing, right behind the elbow, and I'm giving you these landmarks so that you can use this for consistency's sake. Right behind the elbow, you're going to take that tape measure again all the way around so you can get the circumference of your pet's chest in inches or centimeters, whatever makes sense to you. And then number 3 is around the muscles, the thickest part of the muscles of the rear leg. And again, you're going to use this groin fold as your marker. So, and this is still approximate, but hey, you're going to be in the right ballpark and you're going to have some idea what's going on. And then same thing here. Under the armpit and the leg, you're going to go all the way around the biceps. And I'm sorry, this goes up into the chest a wee bit, but you're going to take that tape measure around the front of the leg into the armpit, sort of pushing it up gently so you're always in the same place, and take that measurement. Now, that's going to give you a ballpark idea of the circumference of the bicep muscle. Now, why is this important? Again, if you're not good with your fingers and it's like, oh yeah, this is, this is all muscle right here. And actually, I'm really happy that it actually is, and it's not so much fat anymore. If you can't feel the difference between what's skin, what's fat underneath it, and then what's muscle underneath that, this is a way for you to keep an idea of what's happening with your pet as he or she gets older. And if you find, whoa, man, he's looking really thin in the rear end, and you take the measurement, you're like, holy crud, he's lost 3 inches of the circumference of that rear muscle. What's going on? That tells you 2 things. 1, he's losing muscle. And 2, there's something going on to cause that muscle loss. And that's when you go to the vet and you say, Doc, he's lost 3 inches of his rear leg muscle circumference. What's going on? And then the doc goes, huh, yeah, he has. Wow, how about that? Oh my God, his hip hurts, or oh my God, his low back hurts. And then you can take some action to relieve your pet's pain and also start doing things that will help improve keeping muscle on board. Ruth Roberts, your pet's ally. I hope that has been helpful. And if that is the case, ring the bell, subscribe to the channel, like the video, you know the drill on YouTube, and lets me know what you need to know more about. Thanks.